Love has called my name. I've been born again into your family.
Hello guys, welcome back to the channel. If you're new today, my name is Andy and I am a family nurse practitioner. In this video, I just want to show you guys how my day goes with regards to what I do for patients. When you don't have a medical assistant, which is what is happening right now, I do not have a medical assistant yet. I do everything. We do have a receptionist who is absolutely great, and I thank God for her. When a patient comes in and she checks the patient in and does everything, I bring, sometimes she'll put the patient in the room for me. I do the vital signs, get the weight, and see the patient. Now, if the patient is here for a physical, I also do the blood draw, which is why it is so good if you're up to date on your skills. I remember when I was a nursing assistant and I became LPN, that particular clinic, or is it clinic, the nursing home that I worked for, it was a very good nursing home that had a very good established system. And they had this program where they'll teach you how to draw blood, they'll teach you how to start an IV as an LPN. It was optional, it was the job of an RN, but as an LPN, you can be trained to do it and you'll get certified, but you could only do it in their building, right, in their facilities. So I definitely jumped on that. I learned how to start an IV, I learned how to draw blood, and I can tell you that that skill has been so impactful, because even when I became a nurse educator, I did not want to lose that skill. So I always used to tell my nurses, if you need to start an IV, if you don't know how to start an IV, I used to teach people, and I was never one to like teach people stuff that I can't practically do. So I always used to tell them, if you have a hard time, maybe you have a hard stick or something like that, please grab me and I am so ready to do it, so that I don't lose that skill, because that's a skill that you can lose. So I'm so glad that I never did lose it. So they used to call me a lot and I'll do that. And even when I became a nurse practitioner, I remember my very first job as a nurse practitioner working in a pediatric clinic. I'm going to put that in my video up here to tell that talks about my experience. I was so upset when, I think that was when COVID first hit, and I was so upset when that my boss at that time made us give our patients vaccines when they come in, and I was like, why? I'm a nurse practitioner. Why I gotta give kids vaccine? And I'm so grateful now, because I use that skill now, and I give the kids that I see vaccines. I'm like, oh my God, God works everything out. So I'm going to show you around in my lab. So basically today is about the skills that I do, mainly phlebotomy, right? Because when a patient comes in for blood work, or comes in for a physical, or maybe they have an acute concern and you have to draw blood. Can you imagine if I didn't know how to do it? Like, that would be terrible. So I do it, I draw the blood, I put it in the centrifuge for the ones that needs to be spun. And then we send it out to the lab and they send us results. I use Quest, and I have to say that I love them. I will always use them, not because they are the best, but because they are the ones that actually helped me out when I first started and I didn't really have patients. Everywhere else that I call were asking me like, how many patients do you have in a month? Like LabCorp. But Quest was like, you know what, they set me up, even though I wasn't having a lot of patients. It doesn't matter. They were working with me until I build up my numbers. And so I'll stick with them. That might be free advertising, but whatever. They were really good. And the person that they assigned to my account was really helpful. So those things touch people, and yeah, so that's what it is. So this week is about phlebotomy, drawing blood. So we do all kinds of blood work here: BMP, basic metabolic panel, complete metabolic panel, or comprehensive metabolic panel, complete blood count, lipid, HIV, that's your STI, syphilis, folate panel, whatever my patient need. I draw TB, quantiferon the other time because one of my patients needed that for her job. So all kinds of blood work, and I always to use resources. If there's any time that I'm not sure what tube to use, you can either call Quest or you can look up online. Very easy. They have the resources there for you. It tells you what tube to use for what, and then you can look up their site and it will tell you the code to use and stuff like that. So yeah, I'm very, very grateful, and I hope you enjoyed this video. Okay, all right, let's go.
Love has called my name. I've been born again into your family. Your blood, it flows through my veins, and I'm no longer a slave to fear. I am a child of God. I'm no longer a slave to fear. Oh yeah, I am a child of God. I'm no longer a slave to fear. Oh yeah, I am a child. I'm a child of God, I'm a child of Abba Father, oh yeah. I'm no longer a slave to fear. Oh Lord, I am a child of God. See, I am a child of God. I am a child. I'm a child of Abba, I'm a child of Master Jesus. Oh, I am a child. I'm a child of God. I'm a child of God. Yeah, I am a child of God. I will only go where you want me to go. I will only do what you want me to do. You are the spirit of light. Yeah. You are the spirit of truth. Yeah. I will only go where you want me to go. Yeah. I will only do what you want me to do. You are the spirit of light. Ooh, you are the spirit of truth. Spirit, silent. Spirit, 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 spirit. Oh yeah, spirit, oh yeah. Yeah. Spirit. My Jesus, my Savior, Lord, there is none like you.
All right, guys, the process of, blood draws and stuff. You guys just saw me collect blood draw, and I want to show you how I process the blood draw. Typically, for a standard annual physical, you get 3 types of blood draw: a CBC, basic metabolic panel, and a lipid profile. Of course, if it's a young person or anyone at all that would like to get, STI testing done, like HIV, syphilis, gonorrhea, chlamydia, then, of course, you would add those. So I will show you guys, for example, the tubing, right? So this is what you typically use for a CBC and an A1C. So if a patient is diabetic and you want to get their A1C, you use the pink tube. And then this is what you use if you wanted to get a quantiferin test. That's a TB test done. And this, the red tube, the red top is what you use for a lot of things. So you use this for folate panel, you use this for hepatitis C, you use this for BMP, CMP, you use this for your lipid profile, you use this for HIV. Okay, so a lot of things I use with this. So what I do after blood draw, of course, I print out the patient's requisition and I put it in because it has to match, everything has to be labeled, match the patient's name and date of birth. So I put it in at the time of collection. So now I'm going to put in her CBC. So when you collect the blood, you have to think CBC, you turn it for about 8 times. So you have to put it in here and you use Quest. So usually we'll schedule for our pickup and Quest will come and pick it up. And then, of course, the one that we need for the lipid panel is in here. Now, the BMP has to be spun, or you have to spin it in a centrifuge. This is our centrifuge. The good thing about this is that Quest, whoever company you use, I don't know any other company, I use Quest, they supply everything. The reason why you need to spin this is because you need to separate the plasma from the blood cells, because the red blood cells can get in and contaminate. For the result to be accurate, this has to be spun, and you have to spin it within 2 hours, and it will separate it. So this is a centrifuge. I will spin it, and then when I'm done spinning it, spins it at a right high rate. And then when I'm done spinning it, I'll come show you guys what it looks like. After you spin it, then you send it out for the test. So it has finished spinning and I'm about to put it in. So let me show you what it looks like. So first you're gonna unlock, open it. After you spin it, you see how the plasma is separated from the cells, the red blood cells. That's what it should look like. That is what makes the test accurate. Now I'm just gonna show you guys around our lab just so you see. I have a patient that is here. Okay. All right. So this is our lab. Let me put this down here. So this is essentially our lab, and I'll show you out from outside. So this is basically where we keep most of our storage, like our blood draw stuff, stuff like we need for blood counts. Blood drawers are in here, and of course we have this here where we do like little testing and stuff. I'm in here, and she ran. This is Miss Laurie, my amazing co-partner. That's right. We have somebody. Okay, awesome. All right. So this is our centrifuge where we spin the blood, the ones that needs to be spun, and this I order the blood work, and of course I have to in the right place, and I print it out. She's so graceful to pick them up for me. I'm actually going to separate one of these. What is this? So okay, I'm going to put this one here and to get another bag. Oh, see. And I will this one, because the one is separated, put this one here and put the right separate. And this is a blood that I just spun. So what I'm gonna do is I'm gonna take it out of the centrifuge, unless she already took it out. Sometimes she does. Okay, she did not. So this one that was spun, I'm gonna take it out and add it here. All right. Okay. All right. So now I'm gonna go ahead and see this patient that is here. So you guys come with me.
Yeah. Spirit. My Jesus, my Savior, Lord, there is none like you. All of my days, I want to praise the wonders of your mighty. My comfort, my shelter, you're the tower of refuge and strength. Let every breath, all that I am, never cease to worship. Shout to the Lord, all the earth, let us sing. Power and majesty, praise to the King. Mountains bow down and the seas will roar at the sound of your name. I sing for joy at the work of your hand. Forever I'll love you, forever I'll stand. And nothing compares to the promise I have. Nothing compares. Nothing compares to the promises that I have. Oh yeah, nothing.